Some people are identified as having extremely low levels of vitamin B12 in their blood, but none had the symptoms of a vitamin B12 deficiency. Some people also had all of the classic symptoms of pernicious anemia and a vitamin B12 deficiency, but had vitamin B12 levels in their blood that was over, in some cases well over, the lower threshold used to determine a vitamin B12 deficiency. Even where low levels of vitamin B12 is detected, only around half of the patient's doctors further investigated the cause of the depleted levels of vitamin B12. The most common reason: the treatment will be the same whether you have pernicious anemia or not. A survey of nearly 900 vitamin B12 deficient people revealed serious problems in patients being diagnosed quickly and accurately. 44% were initially wrongly diagnosed as having some other problem. 22% had to wait 2 years for a correct diagnosis. 19% had to wait 5 years. 4% had to wait 10 years, and 14% had to wait 10 years or more. And the biggest cause of complaint by people is their treatment. Many patients receive 1,000 micrograms every 3 months, following a loading dose of 3 injections a week for 2 weeks. The British National Formulary used to recommend an injection every month up until 1974, when it was changed to every 2 months and then to every 3 months in 1984. This is why I recommend self-injecting vitamin B12, because that puts you in charge of your own treatment and schedule. New replacement therapy vitamin B12 products are available, but apart from the oral tablet, none have been evaluated as to their efficacy. Methylcobalamin is used to treat nerve damage caused by vitamin B12 deficiency. It is known as being the cure for neuropathies by repairing nerve damage to the myelin sheath. Many people receive methylcobalamin infusions in the private sector and/or self-inject regularly, with many reporting relief from the consequences of nerve damage. Many people's symptoms are not often associated with a pernicious anemia, including sudden and unaccountable bouts of diarrhea, mood swings, irritability, memory loss, struggling to find the right word or words, confusion, and an aversion to bright lights and crowded places. Tinnitus, as well as hypo and hyperthyroidism and psoriasis, are the most common coexisting conditions, with tinnitus being by far the most common shared condition. Awareness of this needs to be raised among medical professionals. Some people report that they make a complete recovery from their symptoms once vitamin B12 injections begin. Indirectly, pernicious anemia can also lead to marital strife, relationship breakdown, children being labeled as having behavioral problems, employment issues, including unemployment, forced career changes, and in the worst situations, children being taken into care, and this is after treatment to correct the vitamin B12 deficiency. We must all work together to raise awareness of the consequences of a vitamin B12 deficiency and pernicious anemia. If you are experiencing pernicious anemia or vitamin B12 deficiency symptoms, please reach out to me at our website.